Hi there, Dr. Squires at Family First Chiropractic and Wellness Center. A lot of people are surprised to learn that we treat a lot of pregnant patients in our office. So what can chiropractors do for pregnancy? Why do we help? Why are we so popular with the pregnant population? There's a really good reason for that. The two main complaints that come along with pregnancy are low back pain and hip pain. So two things chiropractors are already really good at treating, whether or not the patient is pregnant. So there are some things that we do have to keep in mind when it comes to pregnancy. So we have a couple things that we check in addition to a regular chiropractic exam, but then we also add different parts to the adjustment as well, specific for pregnancy, like I mentioned. So with pregnancy, it's a very uncomfortable process to begin with. Things are always moving and changing day to day and week to week. Even pregnancies compared to one or the other is usually different. So if it's your first pregnancy, you don't know what to expect. Everything's unknown and you can't really understand it until you go through it. But if you've been pregnant before, you can notice that current pregnancies are different than the ones before. Like no two pregnancies are really ever the same. So we're able to stay on top of those changes and work with the unknown as they start to happen. So to help keep our moms as comfortable as possible so they can focus on getting ready for their baby to be here instead of focusing on being in pain right now. So the two complaints that I mentioned, so low back pain and hip pain. So what that actually looks like with pregnancy. So low back pain, as the center of gravity changes, so the belly gets bigger, center of gravity comes forward, it puts a lot of different kinds of stress on different parts of the body. So there's a lot of extra pressure on the joints and the nerves in the low back, and it can pull through the diaphragm, pull through the abdomen, and pull through the inside of the hips as well. And there's a couple reasons for that, and I'll get into that when I talk about the adjustment. With hip pain specifically, there's a couple reasons that can happen. So your hip bones are a three-dimensional bone that attach to the back where the spine is and then come all the way around and attach in the front. So any one of these places along the hips can become painful. So one of the big things that happens with pregnancy is that there is an abundance of a hormone called relaxin. And as the name suggests, it causes the ligaments in the body to relax. So whether it's on the front of the pelvis, where the two bones come together in the front, it's called the pubic symphysis. So this has to be able to open and expand to allow for the baby to come through. So if the bone is misaligned on the front, either one side or the other, it's very, very tender and can cause a lot of pain over the pubic area or even on the underside of the belly. So on the back, we focus a lot on the sacrum as chiropractors. So this is the base of the spine where it connects to the two hip bones. So these joints need to be able to move properly as mamas are up and moving around. So we're going to check the sacrum to make sure that it's aligned, that it's not being pulled off to one side or the other, it's not rotated in any capacity. So this can stay in proper alignment. So what a pregnancy adjustment actually looks like at a chiropractor's office is we focus on those two main parts. We focus on the bones of the pelvis, but we also focus on the soft tissues of the pelvis. So this is the muscles, the tendons, the ligaments, everything that attaches to these bones and allows them to be able to move. The pregnancy-specific technique that we use is called Webster's technique. So we look at the bones themselves first. So again, look at the sacrum, look at the alignment of the hip bones, look at the pubic symphysis on the front. Are all of those spots in alignment and where they're supposed to be? So when they are, the birth canal is nice and open as much as possible to allow for easier passage of the baby. But if one of those is out of alignment, you can see how it changes the shape of the birth canal, and that can become a problem when it's time for the baby to actually be born. Looking at the soft tissues during the Webster technique. So the muscles specifically, the two main ones that we look at, one is the hip flexors. So where the hip flexors attach the front of the spine to the inside of the hip. So again, as the belly comes forward, the hips start to tilt forward, which puts a lot of stress through the hip flexors. When those are too tight, the muscles on the back of the hips, so the glute muscles, the piriformis muscles, become too tight or weak, which, depending on which one it is going to cause pain within itself. And then the main ligament that we work with during the Webster technique is called the sacrotuberous ligament. So on the back of the hips, The sacrotuberous ligament attaches the sacrum out to the sit bone, or your ischial tuberosity, so sacrotuberous ligament. If this becomes tight, it pulls those two things together, and you can see how that starts to move different parts of the pelvis just because that one ligament is tight. So we can release that ligament and help keep those bones where they're supposed to be. If you have any questions specifically of what the adjustment looks like, consults are always free with us. I'm happy to answer any questions, and I'll walk you through everything before we actually do an adjustment.